Okay, so I'm doing task 2, which is pre-anesthetic preparation. So I've got our patient's chart here. Harley, she's getting a spay gastropexy done today. So I will verify that the doctor has done her exam. So up in our right-hand corner here, we've got our weight, temperature, heart rate, respiration rate. So the doctor's done all of that. We've also done a CBC and a Chem 10. That's our usual pre-anesthetic blood work. That was all within normal limits. So now, I've consulted with the veterinarian on what our anesthetic plan is for this spay and gastropexy. So for pre-medication, we're going to do ACE promazine at 10 mg per ml, atropine, which is a dose of 0.54 mg per ml, and butorphanol at 10 mg per ml. We'll induce her with propofol, which is a 10 mg per ml dosing, and then we'll maintain her under isoflurane. So the doses for the ACE promazine is going to be 0.02 mg per kg. So I'll just go ahead and calculate this. This patient is 24.5 kgs. I got that by dividing the pounds by 2.2. So I'll go ahead and do 24.5 times 0.02, that dosing. And then I will divide that by the mg per ml of the drug, which is 10. So that's 0.049, so we'll do 0.05 mils. The atropine, so 24.5, the kgs, times 0.02 again. And then we'll divide that by the atropine, which is 0.54. So that's going to be 0.9 mils. And on our butorphanol, so that's going to be 24.5 kgs times 0.2. And then we'll divide that by 10. So it's 0.49. And then our propofol is going to be 24.5 times 3 divided by 10, which is going to be 7.35 mils. So I'll now have my preceptor double check these calculations. Okay, so now my preceptor Chelsea is going to go through and check all my calculations for the pre-meds and for the induction agent.
Alright, ACE promazine 0.05, that's right. Atropine is 0.9, that's correct. Alright, butorphanol 0.49, that's correct. And propofol 7.35. They're all correct.
Okay, so now we've got our pre-med of ACE, atropine, and TORD pulled up. So that all comes out to 1.4. There's no air bubbles. So now I'm going to go ahead and pre-med Harley here. So I'm going to do this in the semitendinosus muscle back here. So I'm just going to isolate, and then I will poke backwards so I don't hit that sciatic nerve. Drop back for no blood. Gonna get that. Okay, so now we'll go put her in the kennel and let her pre-med take effect. Okay, so now that we've got Harley back in her kennel, I'm just going to monitor her for the next 15 to 20 minutes so that pre-med is taking effect, and then we'll get her out and pre-oxygenate and place an IV catheter. So I have another tech watching our patient in the kennel so that I can finish up her pre-anesthetic stuff. So I'm going to put down, I gave all of her pre-meds IM, and I'm going to do the time. So those were all given at 10:20. And just want to make sure, the rest of this is all filled out. I've got her oxygen flow rate. So that rate is usually 50 to 100 mils per kg a minute. So that's going to be, we did 75 just to be kind of in the middle, so that comes out to be 1.8 liters per minute. I've got her fluid rate calculated, which we do the kgs times 5 mils per hour. So that's 120. And then I've also got her ASA status filled out, which is the one that she's normal healthy. She's a 6-month-old or 5-month-old Great Dane with no apparent issues at all. The gastropexy is just to be preventative in the future, since she's such a deep-chested breed. But her blood work was all good, no murmurs or anything were heard on listening to her heart or anything. So ASA status of 1, so now we're all ready to start pre-oxygenating and giving her an IV catheter and then inducing her.